non-clinical team is as important as the clinical team. I would say without them, it's almost impossible to do anything. So they support us they're kind of the front lines that they're the first face our patient sees. They're the first person our patient connects with on the phone. They have to be knowledgeable in so many different areas. They have to know what happens in the back office. They have to understand dental terminology. They have to have a good personality. They have to be empathic. I have patients that come to our front office and literally pour their heart and soul out to them. They know their entire life story, and they will sit up there for 30 or 40 minutes easily and just chit chat with the front office because they build that rapport and that connection. And that's what I think brings patients back almost as much as their connection with their provider. They enjoy seeing them. They call and they want to make an appointment, but they also want to just ask, hey, how's your new baby? Or what's going on? Like, they're invested in the lives of our front office team as much as our front office team is invested in them. And that's amazing to see because they're just so versatile, and I don't think we would have the same connection with our patients without them. They look to them for questions, they look to them for guidance, to explain things that they may not understand in the chair, or to talk about billing questions, because I don't talk about that in the back with them at all. I tell them what they need, then they go up front and they handle all of that, and they have to be able to explain why they need things and how much is it going to cost and why is it to their benefit to do that treatment. So I think they're hugely impactful, and I would never want to practice without them.